Hello, everyone. It's Michael Jaco with Unleashing Intuition Secrets. Be joined today by Dr. Dennis Pena, podiatry surgeon and wound care specialist, on the potential benefits of stem cell technologies. So he's an expert in this area. I've talked to him for the last several years, and unbelievably gifted in a lot of different areas. I'm going to read his bio. Right now, he's in a pretty much an event where I think he might be speaking, but it's a podiatrist event. So he's getting a lot of a medical event. So he's getting a lot of information from that. Of course, doctors constantly going to, if they're, constantly training, that's great because they bring new information. And he's a cutting edge doctor in this technology. So Dr. Dennis Pena, DPM, Dr. Podiatrist Medicine, UC Irvine, has a BS in bioscience in 1985, a valedictorian in 1991, California College of Podiatric Medicine, Doctor of Podiatric Medicine, DPM, Podiatric Surgical Residency, Veterans Affairs, Palo Alto, California, 1992, Kaiser Permanente, Hayward, California, 1993, Indian Health Service, Phoenix, Arizona, 1994 to 2022. Board certified American Academy of Pain Management, extensive experience with diabetic peripheral neuropathy. So that's pretty much as, unfortunately, as diabetic problems increase, people start to lose their limbs. So he's an expert in helping people maintain their limbs. So that's really good. Board certified in foot surgery, extensive experience in diabetic wound care and limb salvage for over 25 years, provided care at remote Native American clinics throughout Arizona, including Supai Village and the Grand Canyon. Pioneered use of continuous diffusion oxygen for limb salvage, paid speaker for above company EO2 concepts, affiliated with Regenerative Medical Clinic in Baja California, Mexico, and Dubai, where he travels and gathers stem cells and so forth to use them in injections to help people. So he's an expert in stem cell injections, gene therapy, and he's retired Captain USPHS. So, extensive background. Like I said, I've talked to him. He is an incredibly gifted speaker, insights, unbelievable insights. I feel like we've become, really good friends over the years. So he's really, really talented. So some of the things that, with the stem cell therapy, it uses literal stem cells that are gathered from bone marrow. And they're used to treat or prevent a disease or condition. As of 2024, the only FDA-approved therapy using stem cells is hematopoietic stem cell transplantation. This usually takes the form of a bone marrow or peripheral blood stem cell transplantation, but the cells can also be derived from umbilical cord blood. Research is underway to develop various sources for stem cells, as well as to apply stem cell treatments for neurodegenerative diseases and conditions such as diabetes and heart disease. So many, many different ways. I've actually had stem cell injections in my shoulders and in my wrist. They were effective for a period of time, and then it started to, I think, deteriorate. They say that it can only last. It can last up to just 6 months. So you're talking a lot of money. I spent $10,000 on my stem cell injections. They were very, very effective initially, but eventually, over time, the treatment, the benefits basically started to deteriorate. And instead of getting more injections around the time frame where I actually started getting the injections, I started the LifeWave stem cell technology. So this is one of those technologies that Dr. Pena talks about quite a bit. He believes that, as a doctor, if you're not using the LifeWave technology to help your patients, you need to be better informed so that you will start using them. And that's one of the reasons why I wanted to have him on my show, because we're trying to get more and more doctors on board. And there are quite a few actually that are coming on board. Unfortunately, some of them are restricted with what kind of treatments they can use within the medical community, medical field. They're taught a certain branch of ways to do things. Anything outside of that is not acceptable. But there are some doctors that are, doing alternative type of treatments. And that's what Dr. Pena does. He does lots of alternative treatments to provide the best care for his patients. Of course, every doctor is under Socratic, or is it Socratic oath? Is it Socratic oath that they take? So Tracy's like, I don't know. So it's one of those Greek guys. Hippocratic oath. Yeah, thank you, Tracy. Just popped in her lovely head. So Hippocratic oath, and that's got the cult of Asclepius with the snakes going up the pole. So we're like, I don't know about all that stuff. So we have some good doctors that come in and talk about all that. Socrates is a philosopher. So Hippocrates is the Hippocrates is the guy that basically was the doctor dude. And so they all take a Hippocratic oath to basically serve their patients the best that they can. So as many doctors that we're starting to find that have used LifeWave, many of them, more and more of them are starting to utilize LifeWave, and in their own practices, their private practices. Sometimes they're exclusive. They basically have gone completely with LifeWave in their treatments and so forth. They still do blood tests and so forth to check the veracity of the what's going on in the body, if they're having a good effect. And we've seen from many people that they do have incredible benefits. So beneficial, and sometimes extremely beneficial. But of course we can't claim that there's going to help everybody. But I think most people that come in and use the products are going to do exceptionally well. So here's Dr. Dennis Pena. Thanks for joining us, Dr. Pena. Yes,
at a conference.
You're at a conference, so we understand that. So I know you got a limited time. Thanks for coming on. I've already introduced you, read your bio, and so everybody's informed about you. So if you want to jump in, I've talked a little bit about stem cell technologies, which you are expert in.
I'm learning. I'm not an expert, but
still learning, huh? Okay.
Yeah. I'm just fortunate by sharing this LifeWave technology. It's put me in contact with some amazing people that are in stem cell and regenerative. So I know a lot more about it than I did before I started using LifeWave. And what I can tell you is that stem cells are a buzzword now, and everybody talks about like it's the magic bullet. But the truth is, your stem cells, when they're activated by LifeWave, are better than just about anything you can get on the outside, because what they're called mesenchymal stem cells means they come from the mesenchyme. There's 3 germ layers: endoderm, ectoderm, and mesoderm. The ones that most people are getting, I'm trying to stand the light here, that are getting at a clinic, especially if you're getting them in the US, you're getting your own 50, 60-year-old stem cells. They're not very active unless you've been using LifeWave. If you go out of the country, you're still getting the same type of, you're getting stem cells from something else, but it's only can make the mesenchyme, so that's bone, cartilage, and fat. The stem cells that we use in our clinic, that my partner uses, can become all 3 germ layers. It's $6,000 for one injection. Like if you want to come to me for your knee, I'll take your $6,000. God, this is weird. I'm trying to stay in the light here. Or I'd be happy to sell you, or Michael would be happy to sell you a much better something that's there's no guarantee, but like you were just saying, I'm dovetailing on what you said. You're going to get better results than doing almost anything else. And like I said, I'm not trying to, not sell the stem cells if that's what people want, but some people insist on having, well, I need to have this because this is the best, or I know this. They really don't know anything. And the truth of the matter is that activating your own stem cells with LifeWave will make your body will convert your stem cells to a state where they can make all three germ layers, endoderm, ectoderm, and mesoderm. That means nerve regeneration. That doesn't happen with other stem cells, the ones that you would get on the outside. So this is by far and away the best way to take care of yourself. I don't like to talk about fixing things. We say you can't pick the fix. Don't think of it as trying to fix your shoulder or your back pain or your knee pain. It's about age reversal. You're reversing the signal that's coming back from the patch into your body is saying Dennis is not 63 years old, so it makes proteins, peptides, hormones, and enzymes commensurate with a younger age. Now, if people have issues with, and that's why we can build muscle again like we used to, right, Mike?
Oh, yeah.
I mean, because
more, like I'm doing more of my leg press than I've ever done my whole life.
Yeah.
Yeah.
Yeah. And you recover faster. You feel you don't, it's
injuries. Yeah.
Yeah. And it may take a while, but you didn't get old overnight. So, you're not going to don't expect to get young overnight. And it's compounding interest. I mean, we see these people, I see the women on Zoom that I've known for 5 years, and I can't believe how much younger they look.
Yeah.
And they look young. They don't look weird with all kinds of procedures and things like that. So this not just only makes you look younger, it makes you be younger.
And it's like those people have been on the product for a while. It's like they're lit up. You can see it in their eyes and in their skin. It's like their glow.
Yeah, and the energy. You can tell people, like when you go to a meeting, and let's face it, most of the time, like at least here in Phoenix, it's older people because they're the ones who are breaking down and they're open to stem cell technology. But you can tell the people that have been using LifeWave a while, like you said, they're just effusive. They're full of life, and so it's a whole. It changes your whole life, and it's not just for I'll use it until my back feels better. Well, you can do that, but why would you want to revert back?
Right.
So that's
I have a guy. I did the Panama invasion with him. He was in Delta. He was lieutenant colonel in Delta, and I was senior enlisted. So he and I both agree that if we were still in those organizations, Delta, SEAL Team 6 and Delta, we would have all of our guys on this product.
Absolutely,
no question. Yeah.
Well, and that's a great point, because somebody heard my story. So I was using X39 for 4 years, and then I got a coronary artery calcium CT scan done just to show how healthy I was, and it showed that I had calcified arteries. And I said, that doesn't make sense, but it did. So I thought about it, and I went to see what the doctor said, and he said, you have a lipoprotein little a is high. My cholesterol's not that high. Everything, no symptoms. I'm like, and they're like, well, we should put you on a statin. And if that doesn't work, we'll try another one. Then we can try this, and we can do stents. And I'm like, no. I'm not having any problems here. So let's do the tests. Don't stick anything in me. And then I thought about it, and I was thinking, X49, bone, brain, and muscle. So I said, I'm going to add that. And I added it. And within 4 weeks, and I didn't expect anything to change. I was just doing it for my heart for long term. I put on 7 pounds of muscle in 4 weeks. And this is on a body composition scale. So people have heard that. And the reason I bring this up is there's a young man who's 22 years old, and I don't know I think he's on the liveyoungersports.com website. And I talked to him. I said, you didn't do steroids? I mean, he's 22 years old. He's in the prime metabolic fitness of his life. He's not going to get any better than that. He put on 7 pounds of muscle in 2 weeks. So mine might have been 2 weeks, but I just didn't check it. I just happened to randomly do it. But people say 4 weeks, and I've heard other people do the same thing, like Kim in New Mexico. You know, she talks about the bone mass and the muscle mass and everything. And this kid's 22 years old. No steroids, no peptides, no growth hormone. He says, he assures me nothing else, but he was already lifting in the gym. But he's only eating 2,000 calories a day. And he's running 3 times a week, 3 to 4 miles to get ready for a half marathon. That's catabolic. You can't build muscle doing that, right? When they're starving you in the SEALs, right? You lose a lot of weight, right? You're running and doing all this. He built muscle under those circumstances, and he's 22 years old. He's the guy that we show the little scale. Oh, when you're 20 years old, you have this many stem cells. And then when you get to 30, it's here, and 50. And
Exactly.
It's here. So he has stem cells. What the hell happened?
Staying up there. Yeah. It's amazing.
It's the best thing. And then, but the other thing is, it's great to build muscle and stay young and strong and things. But what about the things that doctors don't have answers for? And this is the best thing. It's helped the PTSD, people with PTSD, anxiety, and then the inflammation, irritable bowel syndrome, the skin problems, because the treatments for those are immunosuppressive drugs that increase your risk of cancer and infections. So the doctors just don't have anything like this. And then the one thing, I want to be a bearer of bad news, but it's also a wake-up call. I said this on Connie's Zoom today, Doctor. The cavalry ain't coming. The doctors aren't going to come and save you. No, you better take responsibility for yourself, because
Good point.
So I'm at a diabetic foot conference. A lot of people have pain, neuropathic pain, burning pain, feels like they're walking on glass and can't sleep, and they give them gabapentin as the first choice of drug for that. I prescribed that for several years. It's a terrible drug for that. Now, it may help some people, but most people can't tolerate it. It's a seizure medicine, so it's not made for that, but they don't want to give people opioids. So the lecturer who was talking about this, and he's at an academic institution, he said, what we've been told by the FDA is we should, to best help the patients, is lower their expectations on the pain relief they're going to get. Basically, it's like we should just teach them to suffer. Don't expect much. We don't have anything. After 5 or 10 years, the nerves may burn themselves out and your pain might go away. That's the answer. Just learn to take it. And I'm here at this conference, and that's all they're talking about is diabetic complications and things. And I'm telling people, I can do, of course, I'm sharing it with whoever will listen.
Sure.
Saying, I can do more than all of these things here with these little patches.
Oh, that's good. Good for you, man.
It's the best thing you can do with your life.
Yeah.
You know that.
This is the problem, like you're saying. They're trained within a certain parameter, and they're not supposed to get out of that box.
Especially now.
Yeah. So to use that, they can actually potentially get in trouble if they use that in conjunction.
Oh yeah. Yeah. Like all your guys. Well, story that I think, what's his name? Thomas. I can't remember his name. He's a good friend of David Schmidt, and they've taken things to, and I think you did too. You tried to take it to the DOD.
I did.
Yeah.
We tried to take it to SEAL teams for the retired guys and the guys that are still active, and the nurses that are in charge of those programs. They were super excited. They were like, "This is going to be so great. We just need to run it up and get it approved." And
who better to bring it than you?
Didn't get approved.
Like, if they're not going to listen to you and they don't listen to me, don't be surprised. Then this is for all the people out there building the business. People tell Michael no. They tell Tracy Joe, no. But you look amazing. You look so good. Oh, he's been replaced. He's a bot. And you hear all that stuff.
I know. I get that all the time.
Yeah,
So
and then you say it's this. They go, oh, no. So don't get discouraged. This is the best thing you can do with your life. I would have never met Michael and Tracy Joe and Jennifer and the whole team and everything. And they're not even in my team, but they're my family. I
yeah.
love all you guys. And this is, like I said, this is an amazing experience. It's the best thing you can do with your life. And I just keep sharing it. And I walked away from the government so I could do this, because this is more, I can help more people, help other people with this. And it's brought me to, like I said, all kinds of things. You just keep sharing it. Wear it, share it, is what I say.
Yeah. So you're in a podiatrist and you're
Yep.
do wound treatments and so forth. How do the patches help with that?
Oh man, if I had a practice, I would use this not just for pain, but this is helping people blood sugars become more normal. This is about regeneration and rebalancing. So we don't, cure, prevent, blah, 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 but diseases are just words that we've put on symptoms or situations. So if your blood sugar is high, it's not diabetes, it's just hyperglycemia, like hypertension. And the body says, whoa, this is not a healthy state. So we're going to, we're going to work on this and we're going to bring things back into balance. And that's why people's blood pressures come down and their blood sugars. And it just puts them in a healthy state, the way we're supposed to be. And it's such an easy thing. I mean, the barrier to entry is nothing. Just put on a patch. You don't have to drink a shake. You don't have to swallow pills. You don't have to do anything, but it will help you transition. It's like a bridge, or it's like a biohack. It will help you want to work out again because you're not feeling beat up after you work out. You're like, oh, I feel pretty good. I'm going to keep doing this. So it just incentivizes you to develop healthier habits. And it's like I said, the big problems are people being over fat. Nobody needs to lose weight. They need to lose fat. The way you lose fat is by building more muscle. This allows you to build muscle, and then your basic metabolic rate increases. So everything just comes back into balance. Like when and many people, let's face it, they were never as healthy as they are now. Say you're 50 years old. I've met 50-year-olds who said they've never been healthier because they grew up in a time when they didn't exercise. They didn't do the things that we do.
Right.
So it's just, yeah. And I would use it in my practice, and definitely family practice doctors should really gravitate to this, because all they have is meds, and all they're doing is titrating your meds, and it's not solving anything. It's not, they're definitely not healing or preventing or curing anything either.
Right.
So.
Or like you said, we need to do it ourselves. We need to get involved and help ourselves. Here you are, in Mexico with the stem cells.
Yeah, I had to go to the airport and pick up the stem cells. I built a pickleball school down there for this guy to help him out, and I got him a job working with the doctor for the stem cells, and he didn't want to go pick them up for some whatever was going on. So I said, well, I'm going to go get them. So I went and picked them up, and it's been a crazy ride, and it's just getting started. Like I said, I got projects going from Cabo to Canada, and it's just because of the connections I've made and the sharing and caring. And like I said before, nobody could have sponsored me this business except for Connie. And you're probably the same way with Jen or whoever it was. It's that trust, because I know Connie and Barry for a long time. I know they're smart business people. I know their heart. And they said, this is what happened. I said, okay, I'll try it. And I didn't feel anything right away, but I said, well, it works. I put it on other people and it worked. I go, all right, now I'll read about it. I'll learn. I didn't learn it. People, why am I going to read all this stuff if it doesn't work? Right? But that's the other message. You listening may be the only person that can sponsor. And I'm not saying you're going to sponsor a doctor or a celebrity or but nobody's going to listen. There's the person that really needs this for their health, for their life, and you'll be the only person that they would listen to. So just like I said, wear it, share it. I know it sounds like a broken record, but it's the best thing you do. When I hear these stories, people start crying and everything else, and there's nothing better. So I'm very proud to be on your show, and I love all your people, and your house looks great there. I see the Christmas tree back there, and
oh yeah, it's great at night. It's good.
Yeah.
We got wreaths and all kind of crazy stuff. So we went all out. It's beautiful.
Yeah, yeah. All right, I got to get back to the conference, but I appreciate the chance to share, and I hope that you never know what you're going to say that's going to trigger is a bad word, but in a positive way, so they're going to trigger something in somebody to go, yeah, I get it. But you have such amazing stories in your people, with Jen and Fred and all these guys. I just love all your guys. It's not lucky. I mean, you've been blessed to build that community, with all, and you know that beforehand. And then LifeWave is just like made it even more unbelievable, right?
It's totally unbelievable. Yeah, it's just completely changed my life. So it's just been fantastic.
Yep.
So yeah, I appreciate you coming on. I know.
Hey, glad I can make it. Yep. And all, if you have specific things we can talk about next time, but I just want to tell people, doctors they're not going to help you.
Oh, you are. So not all doctors. So
yeah. And most of them care, but they're so busy, and and like you say, they've been indoctrinated.
Right.
So don't give up.
That's right. Help yourself. Get involved. Get with the patches.
Yep.
All right.
Thanks. Love you guys. Bye-bye.
So yeah, I mean, a lot of us, are getting great results, like Dr. Dennis Pena was talking about, and get yourself informed. The LifeWave patches are super simple. They come in sleeves. You get 30 in a sleeve. Last year for a month. 12 hours on, 12 hours off. You can activate your body in a lot of different ways, and there's so many benefits to the X39. Like I said, I and other people that are into the patches that were, high speed guys. I was in SEAL Team 6, of course, CIA and all that kind of stuff. And then there's another guy that I've done shows with that was in the Panama invasion with me and the Delta side. And he's like me. And not only was he in the Delta side, but he also did contracting like I did, and for different groups and so forth. But we've stayed on the cutting edge of, keeping ourselves healthy. And when we found out about LifeWave, we're like, oh yeah. It's been amazing. So I'm going to share a video of LifeWave, a little promo, little video, little motivational video that we have within the community. And I like it. I think you're going to like it. So let's share this one.
You are a powerhouse of growth, of new experiences. You just don't know it yet. Let's change that, shall we? With innovation at our core, we've reimagined what's possible. Harnessing the body's natural energy flow with light. Backed by clinical research, X39 stimulates the skin with low levels of light to elevate a key peptide linked to renovating and rejuvenating the body. This life technology supports improved movement, recovery, and overall health and well-being. You are Generation Awesome. Shifting paradigms and creating new ones. We always knew you had it in you. Now it's time to prove it to yourself. Your adventures are only beginning. Discover the power and simplicity of doing more with X39. Be the light. LifeWave.
Be the light. The light is within you. You activate the light by putting on the patch within you. It's transdermal, meaning it doesn't penetrate the skin. There's no, like Dr. Penny was talking about, there's no internal drugs. You're not taking anything internal. You're not rubbing anything on you. You're nothing like that. You just put the patch on, and the patch basically has the potential of doing amazing, incredible things. So activating the stem cells and so forth. There is another product along with X39 called Cellergize, and you take that. There's a morning and evening. So the morning basically has stuff in it that helps activate your stem cells, and it's been proven to activate. Of course, the X39 does as well, but the FDA likes to play games. Of course, we know that. And so when you use the Cellergize morning and the X39, you can actually say that, yes, your stem cells are being activated because there is a plant product that's in the cellular gyres that basically has been proven through medical research to actually activate the stem cell. So X39 has many patents. Getting one patent is extremely difficult. I can imagine what I know. A lot of people have tried to get patents. I like look at what you have to go through to get a patent. I'm like, geez, how do you even get one of those? But David Schmidt has over 200. He's got 201, maybe even more by now. So it's pretty impressive. All of the different things that we have within LifeWave. There's new patches that are coming out. I'm actually trying one of those new patches. It's phenomenal. I can tell you that. I can't tell you anything more than that. But it's a new patch that's going to be on the level of the X39, right? So and of course we got the water machine that's coming out, the X2O, which is fantastic. I think it's one of the most cutting edge products that's ever come out at any time in history. So many benefits of being involved in LifeWave. In the description box, there is a way that you can come in as a customer, come in as a brand partner, and if you really like the product, then you share the product, and you can benefit from that. There's a lot of us that have benefited not only from the stem cell technologies and the light activating technologies that come with LifeWave, but also from a financial perspective. You can actually add income. A little bit of hard work and sharing is pretty easy, I think. But I've been involved for like over 3 years, and I have an extremely successful business. For over every year that I've been involved, I've been the #1 customer acquirer in all of LifeWave. For 3 years, I was for the world. This year, it slipped because I take a lot of people that come into my business and I share them with the doctors and other people that will I know that will be as customers come in that will best be suited and benefit from those people that are really managing their groups really well. So I have several people that are involved. I have 5 people that are involved in my business. So I take care of people, and we're building a great business. So we'd love to see more of you guys get involved, not only in the magnificence of the patch, but also with the financial benefit potential that you may have. All right. So a little bit of share today. I like to continually share at least once or twice a week, as you guys have been seeing going forward. It's a fantastic product. I say it's the most fantastic product by far that I've ever utilized. Ever. Right. So just like Dr. Penny was saying, we can tell you that this little patch that you put on your body is going to be extremely beneficial in multiple ways. But most people are like, it can't be that easy. So we have to, train the mind and train the body. And this is the way we do it. We get this information out there, and hopefully it will inspire you to get involved with LifeWave. All right. Lots of love to you guys. And for those of you, it's just 3:33 there. Just clicked over to 3:34. But I'll be back again at 4 for another show. And if you're seeing this later, then disregard that. But so those of you that are in the chat, I'll see you guys in about a half an hour. All right. Lots of love.